It is June 3rd, 2021, and I am going down to UC Davis to speak to their cardiology department. With Marlow, the cancer hospital.
Apologize for it.
Oh, it's okay.
How you doing?
I'm doing all right. I'm doing all right.
Good. You want to give me a kidney?
I would very much like that. Yes.
Okay. We're gonna see if we can help. You have had diabetes for a long time.
Yeah.
Type 1, type 2?
Type 2.
Type 2, okay. High blood pressure?
Yes.
Cholesterol?
No.
No.
Okay.
And you're on peritoneal dialysis.
No. I was, but I'm on hemodialysis.
You're on hemodialysis. Where's your fistula?
It's graft.
Okay.
So it's right
Right there.
can,
I can see it.
yeah.
Nothing in your right arm?
Just the no, nothing.
Nothing in the right.
Okay, just left.
Okay. Today's Thursday, so Monday, Wednesday, Friday?
Yes, Monday, Wednesday, Friday.
Monday, Wednesday, Friday. Okay.
Mm-hmm.
And where do you live?
I live in Fairfield.
Oh, okay. Not super duper far away.
No.
Okay.
So it's literally like 45. It's not
just down the
you know,
road. Yeah.
It's not like I'm in San Francisco or anything. Right?
No. Yeah, one of my guys earlier was from almost Monterey. I'm like, man, that's a long drive.
Yeah, it is.
Okay. How do you feel?
As far as what,
Chest pains, pressures, tightness, anything concerning about your heart?
No. I've never had any issues. I've never had any heart issues.
Okay.
I don't have a family history
Okay.
of any, heart issues or anything like that.
Do you smoke?
No.
Do you drink?
No.
Any street drugs?
No.
Of course not.
No, I'm not like doing meth. No.
You'd be surprised.
No, I don't do that. I don't do anything.
Good. Why did your kidney fail?
It was a combination of a lot of different things. I'm sure it was probably a combination of both, like the diabetes. The diabetes probably contributed.
Yeah.
Probably a huge factor. High blood pressure. When you work job, you don't have insurance. You can't get the medicine you need.
It's no problem.
But I think initially what sent it over the edge was I got sick with an rare autoimmune disease.
Okay.
Like, I don't want to sound like pretentious when I say, it's a rare autoimmune disease.
No.
I got diagnosed with something called HLH.
HLH. Okay, sure.
And it required emergency treatment.
Yeah.
So it required chemotherapy and a lot of very powerful drugs that came along with that.
Yeah.
And then in less than a year, my kidney started to fail. Like, immediately after my treatment was done, like after all the chemo was over, all the drugs, my kidneys immediately went into failure.
Okay.
Like in less than a year.
Okay.
Or maybe like a year less. I had no time to even register or process it.
Okay.
It just went from one thing to another. And, here I am.
Are you considered in remission from your HLH or cured?
I am considering in remission. I just spoke to my oncologist yesterday, and she was looking at my. She every time I go to see her, she does blood work.
Yeah.
Just to do like routine maintenance.
Yeah.
And she has no reason to believe that
it's gonna come back.
Yeah, that's gonna come back.
Okay.
And then that you kind of use common sense. If I do get the kidney, I'm going to be on immunosuppressants that suppresses the immune system, which suppresses my immune system, which makes it, better for the HLH.
Right. Okay. Good. Other than the catheter that you had in here and the graft here, any other major surgeries before?
No. I've had like minor surgeries, like, bone marrow biopsies, kidney biopsies.
Okay.
Just like the standard stuff. But no like major, no major reconstructions.
You still have your gallbladder?
Yeah.
You still have your appendix.
Yes.
We haven't stolen anything from you.
No.
Okay.
My stuff's not floating around the black market.
No, okay.
No. I still have like all of my, appendages.
Yeah.
Just the graft. I have a portacat.
Portacat. Okay.
Yeah, but that's pretty much it.
Okay. That is small stuff.
Yeah.
And then as far as other symptoms go, do you get short of breath with activities?
Only as a result of the kidney disease and the dialysis.
Okay.
Before, I never really had that problem.
Okay. Okay. As far as your weight goes, your weight has been stable lately, going up, going down?
It's been stable. Like it goes up,
waffles a little?
Yeah.
Okay.
Because it fluctuates according to how much water I'm drinking.
Right.
But, I've lost a considerable amount of weight from between, like, the chemo and I've gained weight and then I've lost it just over the 3 years. So it's like a 3-year span.
How about just in the last 6 months?
Last 6 months, probably nothing really.
Stable.
Yeah, maybe like 2 or 3 pounds.
That doesn't count. Okay. Yeah. When you sleep at night, how many pillows do you use?
I use all the pillows.
All the pillows?
No. I only really I just have them for comfort because I'm a baby and I just like to be comfortable.
Okay.
So I think I have like 8 pillows, something like that.
When you sleep, do you sleep lying down flat or are you propped up like you're sitting in a chair?
No, I lay flat.
Flat. Okay.
Yeah.
Then we're fine. That's really what I'm aiming for. Okay. Blood pressure. The first one was high. The second one was better. Okay.
I also do take blood pressure medicine. So if that seems elevated, it's because I don't usually take medicine when I'm out and about.
Got it.
Because it affects me, my activity.
Are you still taking diuretics, Bumex?
Yes.
And Norvasc is your blood pressure medicine?
Is that amlodipine? Yes.
And Carvedilol?
Yes.
And hydralazine? Okay. Am I missing anybody?
Bumex, Carvedilol, hydralazine, amlodipine. And those are the main ones for the blood pressure.
Okay. All right. Your EKG looks all right. You want it?
Oh, sure, yeah.
Let me just tell her real quick. Normal sinus rhythm, non-specific T-wave changes. It says non-specific T-wave abnormality. All they're saying is that, where'd he go? This guy right here. This little hump after the big spike normally is upward and it's downward. That's the only major thing. Kind of the same, kind of right over here too.
So what does that mean?
Nothing.
Okay. I was just about to make that suggestion to you about that.
It means nothing.
I was like, yeah, T-wave.
T-wave abnormality.
That's what I was about to say.
I
have no idea what it is.
Sometimes it's good to have one when you're normal. If you've got any sort of abnormality on your EKG when everything's fine, then if you ever end up in the ER for some reason, they get really concerned. You can pull us out of your wallet and be like, "This is what it looks like when it's normal," and then go, "Oh, okay, fine."
So if someone that exercises a lot, like, because I try to exercise every Saturday, I go and I exercise.
Yeah.
For 2-3 hours.
Sure.
Will that affect? Like, will that show? Because I've heard stuff about athletes having like lower heart rate or blood pressure.
Absolutely, lower heart rate, lower blood pressure in athletes is no question, right?
Okay.
If you were an extreme marathoner or a professional cyclist or one of these really like way highly trained Lance Armstrong style kind of athlete,
right,
you definitely can have some EKG changes.
Okay.
Your weekend warrior types, or you've got to be somebody who's really, really highly trained to make your heart change the EKG based on your fitness level. Really highly trained.
Right. As you can clearly see, I am.
Me too.
No, I'm not. I'm very tired all the time from dialysis. I'm very tired all the time.
I understand. I have little kids. I'm really tired for a different reason. All right, let me take a quick listen to you here, okay?
Okay.
Okay. Deep breath. Good. Out. Same thing, a little faster. Perfect. Oh, that's perfect. Twice more. Okay. Chin up. Don't breathe for just a second. Okay. I'm gonna feel your wrist here for a sec. And your feet.
Oh, okay. No, I can.
This is fine. You're fine right here. I'm just going for the ankles. Okay. So here's the deal.
Okay.
The transplant team has a little bit of paranoia in regards to patients who they want us to put on the list. Okay?
I've
It's
gathered that.
It's an appropriate paranoia in a lot of cases. Okay?
Yeah.
As a part of their algorithm, they have said, again, not without good reason, that there's high risk for folks having heart problems who have been on dialysis for a long time, who have had diabetes for a long time, who have had high blood pressure for a long time. That's you.
I've only been on dialysis for a year.
Okay,
Right.
fair
But
enough.
The other
But
two.
your other two, for sure. Okay, there's several different ways of going about and assessing the heart for what we call coronary disease, right? Which is just narrowing plaque buildup, cholesterol buildup in the arteries that feed your heart muscle. Okay, and once you reach certain thresholds, the utility of some of them become less, and you start getting into the more gold standard type testing. Okay, the gold standard test is what we call coronary angiogram. Okay, and what it does is it gives us pictures that kind of look like this, and the way we do it is somebody like me puts a little IV into one of your arteries, either in your groin or in your wrist. We put these really long tubes up to the heart, and we squirt dye down the arteries one at a time and take an X-ray picture. And the nice part of this is that if we find some major narrowing that needs to get fixed, that surgery would be safe for you, we can fix it all in one fell swoop.
Okay. Because I've had similar surgeries before. Like I've had ballooning in the graft.
It's
I've had PICC lines before that go to the heart. So.
very similar. Very, very similar. We're just looking at different arteries, right? And like in the graft is a good size. Your coronary arteries are much smaller. And so we have some different equipment. We're really, really careful with some of our stuff.
Mm-hmm.
Whereas, they can be a little bit more aggressive, like out here in your fistula and stuff in your graft. So, but it's very, very similar, right?
Yeah.
You get a little bit of sedating medicine. We numb the spot where we're going to put in the IV, and then you take a little nap, and I tell you, hey, look, we're all done. Here's what we found. Okay?
Mm-hmm.
The alternatives would be something like a stress test or a CT scan or some of these kinds of things.
Now, all of that I have done.
Right.
When they put me on the treadmill.
Right.
I've had the cardiogram or the camera. I've done all that stuff. And,
Okay.
Yeah, and I've as a result, I've sent that information.
Right.
To the transplant
To the
team.
transplant team.
So they have all of that.
They have all that.
So this was the last thing they
This
needed
is
me
the
to-
last thing.
Yeah, this was the last thing they needed me.
Supposedly.
Yeah.
Supposedly the last
Yeah.
thing. So that's what I'm proposing to you. Okay?
Mm-hmm.
And the
I mean, before you continue, like I'm not afraid.
okay.
Like if you can, like do the through the groin, like I can do it.
We can.
Like it's not a problem.
We can do it.
Like it's not.
That's not an issue. No, the issue is we just got to talk about all the risks and benefits and get you to sign on the dotted line.
Yeah.
That's the real issue.
Mm-hmm.
And if you're okay with it, what I'll do is I'll start trying to get the consent form loaded up, and we'll just go over the consent form right now. We'll go over all the risks and benefits. We'll sign. We don't have to do it when you come in for the procedure.
Yeah, that's fine. Yeah,
Okay.
that's absolutely fine.
Okay.
Because I mean, I've had so many.
You've done so much already.
Right.
Why
so
would we
there's-
stop now,
There's
right?
really no fear.
Okay.
Like I have no fear or trepidation about anything. Like
Okay.
If
Let me
something's
do
gonna
this.
happen, then something's gonna happen. But like I don't really think that people understand how badly
Don't go away.
how badly I want this.
Yeah. No, I want to get it for you.
You know.
I'm just going to borrow her computer for just a second, so that I can load up this consent form.
Like, I really need this, and like I don't want to wait until August or September.
We can get it done this month.
Oh, 'cause that's fantastic. That's great.
We can get it done this month.
sort of wanted to like expedite this process before I got too old for it to matter. You know, so he's 45 now, so we don't care about him anymore.
Yeah, you're not even the youngest guy today. Don't even worry about it.
But I will say the diabetes is also a concern for me too, because I've heard that after, kidney transplant, the diabetes comes back. Like right now, I'm fine, and I don't look at it as it's like, oh, it's a Christmas miracle. I understand that it's just because of the dialysis and them removing everything, and I understand that.
Mm-hmm.
But that is a concern of mine of it coming back.
Set that right there.
So birthday, November 26th.
You can bail or you can stick around, doesn't matter. Okay. All right, so this is the consent form. You're going too fast.
Oh, I'm sorry.
That's okay. That's me. This is what we're planning to do, right? It lists all the different ways we can get to your heart. Most of the time, I use the wrist right here. You've got a really great pulse, and it's really comfortable here afterwards, especially if we don't find anything to fix. You're out the door in 2 hours.
All right.
Okay.
Sounds good.
It's also got all this emergency stuff in here because it's the same form we use for folks who are coming in with a massive heart attack. Okay? So it's got all this emergency support things that we don't plan to use for you.
Right.
Okay?
But in case of emergency.
In case of emergency, it's all ready for us.
Right.
I will be there. I'm explaining this to you. These are potential complications. If you read it too closely, it'll scare the crud out of you. Know that it's rare. Okay? Yeah. It says the terrible stuff: death, stroke, heart attack, bleeding, infection, damage to kidneys, blood vessels, the heart, etc., etc., etc.
Right. Well, the kidneys are already...
Precisely.
Yeah,
right?
the kidneys are already damaged.
Already damaged.
Yeah.
The risk, if we're just taking pictures, right? If we're just going out taking pictures, we don't find anything, take everybody out, probably less than 2% risk of some sort of problem.
Okay.
Okay.
Not a problem.
Pretty stinking low.
Yeah. I saw the highlighted bits, medication with possible...
So, right, this is what we call the alternatives, right? But for you, to get on the transplant list, there isn't an acceptable alternative. Right?
Right.
This is what we have to do to get you on the list.
Right.
Now, we never plan on letting you bleed to death.
Okay.
Okay? But if you were bleeding profusely, we would give you a blood transfusion, okay?
Okay.
Unless you specifically tell me no.
I've had several of those, so
yeah.
It's not a problem.
Okay, great. We will sedate you for the procedure. You need somebody to drive for you.
Okay, I can arrange that.
Yeah, I should say this. You need somebody to drive you home, right?
Yeah.
Because the sedating medicines that we give you will show up if the police pull you over and draw your blood.
Okay.
Okay?
All right.
You don't want your car going to car jail. You don't want to spend the night in the pokey.
Good to know.
Okay.
I wasn't even aware of that. It's good to know.
This is why I tell everybody. We're not planning on saving any specimens. There's nothing else we're doing. Overlap surgery. We don't put your picture on Facebook. We are not enrolling you in any sort of clinical trials or anything like that. I don't get paid extra to do these procedures. I don't own stock in the company that makes my equipment. Right? All of those things.
You're not like a beneficiary.
No, this is my job. This is what I do. A signature.
All right.
Perfect. My turn. Would you like an email with this document?
No, that's fine. No, thanks.
You can, all right. It is logged into the computer, so that way we don't have to do it on the day of the procedure. So the procedure from here, you just go home. We will call you to schedule the procedure. Like I said, we should be able to get it done in the next 2 weeks, no sweat. Okay? And yeah, you need someone to drive. What else? There's no medicine that you need to hold on the day of the procedure.
So I can take all my blood pressure medicine?
Take your normal stuff.
Okay.
Yes, absolutely. They will tell you not to eat after midnight before the procedure.
Okay.
And that's, right, again, we give you some sedating medicines. And if we're being 100% perfectly honest, it's because we don't want you to have a reaction and puke in our room as opposed to anything else.
Right.
The food isn't really all that dangerous to you. It's because we don't want to clean up any messes.
Right. Makes sense.
What else? I think that's it. Questions? You'll get a phone call to schedule.
Okay. So, like, now I'd like your honest opinion here.
Yes.
So theoretically, like, this is the last. The last.
As far as I know, for a lot of people, I am one of the last steps.
Okay, because I've spoken to
I was looking through the committee notes, and they said needs to see the psychologist, needs a cardiac cath.
Okay, so I've seen the psychiatrist already.
I saw that note. Yep. So I think I'm the last step.
Okay, because I don't want to say my issue, but I was under the impression that the last, like when I did the cardiogram and they took the pictures, I was under the impression that was it. And then, after I had to take the initiative. Now, I'm not saying that, oh, well, they should have called me, because I understand I'm not the only person that you guys see. I'm not the only patient you have. And I understand you guys have thousands of people that, are ahead of me that require probably more attention than I do. Understand it. So I have no problem taking the initiative and calling.
Right.
But when I did call, I was not aware that there were still things that they needed me to do, because I was under the impression I was done.
So I don't have very much control of the committee, but here's what I do, right? As soon as your procedure is done, I send a note in the medical records over to your case manager and the doc who saw you. And I say, I just got done with his procedure. His arteries look great. There's nothing from a cardiac perspective that should prevent him from getting listed. And again, that doesn't actually do anything other than put a reminder in their box that we've checked off that last thing.
Right.
Okay?
Okay. Yeah, I wasn't even aware that I'm listed on the CPMC. I'm not active. And once again, that's another thing. I was not aware of that until I took the initiative to call them.
Right.
So I'm walking around under the impression that,
Here's one good thing I can tell you, okay? The, we have like time, you have to accrue time on the list.
Right.
It doesn't start after I'm done with you. It already started, right? Yeah. What they do is they kind of run these parallel lists. There's like active, ready to go, and there's still has things that they need to do, but you still get to accrue time, right? Your time started when you started dialysis.
Okay, that much I did know.
Yeah.
I did know. But it's still very discouraging of like, it feels like I'm missing opportunities here. Like every day that I'm not active is a potential, kidney that I've just missed. I hope that it goes to somebody that can appreciate it, but like it feels like I'm just standing I'm not moving.
I hear you.
I'm just in the same spot.
I hear you.
I'll be 37 this year.
We're going to get you, like I said, we're going to get you on the list as quick as I can, right?
Yeah. And I understand that things just fall through the crack, and like I understand that. Yeah. And I know that you guys are doing the best that you can, but it's still, it's no less frustrating for me as somebody who, my life just stopped because of this.
Right.
Like, I don't get to go to the Bahamas for like 4 days. Like I have to coordinate, and
I hear you.
And I'm kind of on borrowed time, regardless of what anybody says. Like, we're all gonna get there. Yeah, but I'm going there a little bit faster than other people.
I hear you.
So.
I hear you. Well, like I said, we're gonna make sure your heart's in good shape. Okay. As soon as that's done, I fire off my note. Okay. And the goal is that takes you and moves you over from this list to this list over here, right? And then at that point, it's either your number gets called or the kidney doesn't match, or whatever, right? I'm not on that side of things, so I can't tell you exactly how it works.
And I'm not trying to I'm not holding you responsible for that,
I
just
know.
like
you're getting some frustration out, and that's fine.
Yeah.
Right? I got little kids. I get frustration thrown at me all the time.
I can imagine so. Like, I don't have any children, and for, really thinking about it in the long term, I'm glad I didn't, like I couldn't imagine like it wouldn't be fair.
It's hard to be a dad and go through what you're going through.
Yeah, it was just, it wouldn't be fair to them. Like, it wouldn't, you know, like, I don't have the energy to be chasing little kids around. You know, like, I'm glad I made that choice of just like, you know, maybe I'll wait. And then, like, you know, my life went down the drain. It's like, okay, so I made the right decision.
It worked out.
Yeah, it worked out.
Let me walk you up front, get you my card, okay? If you haven't heard from somebody in our schedulers by Tuesday, call. Okay?
All right.
Put a hard stop on it. If you haven't heard by Tuesday, call. And just be like, hey, I know they put the orders in. I want to get on the list as quick as I can.
All right. Sounds good.
Yeah. And pick a day that works, right?
Mm-hmm.
Don't let them pressure you into a day. You tell them, I arranged a ride and I'm coming on this day. I think there's only like 2 days that I'm not around in the next 3 or 4 weeks.
Okay.
So, I'm here.
Okay. Sounds good. Sounds good. All right.
All right. Come on, let's get you out of here.
All right. Well, you have a nice day. It was a pleasure meeting you.
Thank you. Nice to meet you as well.
I do like to hold on. I try to keep everything. Hopefully this is it. So this appointment that I just went to hopefully is the last one, and then I'll be ready to go. They'll send that information off, and then they'll let me know whether or not they can make me active on the list. So fingers crossed. Hopefully this is it.